Welcome back to the Wound Talk series from Molnica. As you can see, Mary is starting to look and feel better because we've learned about 3 essentials of wound healing so far. Before you know it, she'll be back to her usual happy self. In the last episode, we learned about the 3rd of our 10 essentials: preventing and treating wound pain and considering loss of sensation. Now we will explore essential number 4. Why it is important to carry out effective wound cleansing and debridement. Let's begin with cleansing. Cleansing is the removal of dirt and foreign materials. Cleansing a wound and the surrounding skin helps prevent infection and encourages wound healing. Wounds heal best at body temperature, so it is best to cleanse with solutions at this temperature. Debridement is the removal of devitalized tissue such as necrotic tissue, slough, bioburden, biofilm, and dead cells from the wound, wound edge, and surrounding area. This is done to promote wound healing by preventing infection and biofilm formation, as necrotic tissue can serve as a food source for bacteria, preparing the wound for advanced treatments such as antimicrobial dressings, enabling topical agents to be used effectively, reducing odor, stimulating the wound edges and epithelialization, reducing pain associated with devitalized tissue, and finally, debridement helps to determine the extent of tissue destruction and proper wound assessment, such as the depth of the wound. So, it is important to properly cleanse and debride a wound and the surrounding skin, not only to prevent infection and biofilm formation, but also to be able to do a proper assessment, reduce bad odor, and reduce pain. It will prepare the wound for different treatments and promote wound healing and quality of life. With 4 out of 10 essentials of wound healing discussed, we can now take a look at Mary, looking happy, healthier, and ready to take on the next stage of wound healing. Now that we have explored why cleansing and debridement is important, let's take a look at how we implement this knowledge into practice before we move on to our next essential: treat and prevent wound infection and biofilm.